Am I visible? Give me a minute to confirm. If I'm live, I'm visible, I will start the class ahead. You have to give me a minute for confirmation. You can give me a thumbs up in the chat box if you can see me, if you can hear me clearly. Am I live? Give me a thumbs up. Come on. Yes, I hope it's working. Yes. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to continue my PSM series. So we have started a free series of the PSM in which I am going to take the important topics of the PSM one by one. Right, many students requested me to launch this series. So we have already taken one session. This is the second session. I hope you all are there. So can we start? Osama, Nitin, Ujjwal, are you people are there? Okay. So, okay. Let me start. Give me a minute to start. Okay. So today I am going to teach you a topic that is level of prevention. You have to give me a minute to jump on the topic. Just a second. Let me jump on the topic. Just a second. It will hardly take a minute. Yes. So here I am. Okay, so today I am going to teach you a very important topic, that is levels of prevention. Now this topic is important for theory also, and specifically more important for MCQs and competitive exam. In competitive exam you always get one of the MCQ from levels of prevention, right? So what is level of prevention? Why we have to study this in PSM? So today what subject we are studying? The name of the subject is PSM. Can you tell me the full form of PSM? What is PSM? What is the full form of PSM? PSM is preventive medicine, preventive and social medicine. What do you mean by the term preventive? So there is a disease. Whenever there is a disease, we can do two things. Either we can prevent it or we can treat it. The treatment part of the disease is dealt in a subject known as medicine, right? So you all study medicine in your final year. The treatment of the disease already occurred. Now you want to treat it, right? That is known as treatment of the disease. But before occurring, we want to prevent the disease. That prevention we study in PSM. That's why this topic is super duper important in PSM. One of the very important topic in PSM, that is various levels of prevention. You got my point? Now we want to prevent the disease, right? To understand the various levels of prevention where we can prevent the disease, you must understand what is a disease, right? In the first session, I told you the definition of health. Can anyone tell me the definition of health? In the last session, I told you, now Osama. Others, can you tell me? Anyone? The health, the WHO definition of the health. What is the WHO definition of health? In the last session I told you. So health is the state in which the person is physically, mentally and socially well-being. So all three things are together. That is physically, socially and mentally well-being to lead a productive and economic life. That is the definition. Yes, very good Osama. Yes. So this is the definition of health given by WHO. Now I am asking you the definition of disease. The opposite of health is disease, right? So WHO have not defined disease. WHO has not given the definition of disease. WHO has defined health, but WHO has not defined disease. Can you tell me what is a disease? Anyone of you? Anyone? Nardeep, Sarita, Gajanan, Aditya, anyone? What is a disease? Can you define in your words? Okay, so exact definition of disease is given by a person, an epidemiologist known as Susar. So WHO has not defined disease, but Susar has defined disease. Now can you tell me the difference between three things? Is disease, illness and sickness are different from each other, or they are same? We use them as a synonym, but they are not synonym. They all are different. So can you tell me the difference between a disease, illness and sickness? Can you tell me? Anyone of you? Anyone of you? Okay, so Osama is saying any alteration in the body. Let me take you absence of health. Okay, Aditya, let me tell you. So disease, illness and sickness. Disease is either physiological dysfunction of the body, as Osama was saying, or psychological also. Osama, sometimes we are physically fit, but psychologically, mentally we are disturbed. That is also a disease. So you must say disease is physiological or psychological dysfunction. Either we are physically not fit or we are psychologically not fit. So that is known as disease, right? So that is a disease. Physiological or psychological dysfunction is known as disease. So sometimes we have disease from inside. Suppose I am physically not fit or I am psychologically not fit. I am having it inside, but I am not aware of it. The disease in the initial stage, you can say, in the preliminary stage or initial stage, currently symptoms are not there or very mild symptoms are there. I am not aware of it, that I am having a disease inside me, right? So whenever I will have the awareness that I am having some of the disease inside me. So that awareness will make me ill. So I will say I am ill because I am aware that I am having a disease inside me. So for illness, you must be aware of the disease. डिजीज इज फिजियोलॉजिकल और साइकोलॉजिकल डिस्फंक्शन. अगर मुझे कोई डिजीज है तो मेरे अंदर मेरा या तो कोई फिजियोलॉजिकल ऑर्गन इज नॉट फंक्शनिंग प्रॉपर्ली और साइकोलॉजिकली आई एम नॉट फंक्शनिंग प्रॉपर्ली, सो आई एम हैविंग अ डिजीज. बट समटाइम मे बी इट इज वेरी माइल्ड in the initial stage. I'm not aware of it. You got my point. Sometimes we are not aware we are having a disease inside us. But the point, whenever the symptoms are large enough, the big enough, so that you become aware that you have a disease inside you, at that point you become ill. Before that you are only diseased, you are not ill. But once you become aware, you are ill now. What is illness? Illness is the awareness of not being well. You are aware that you are not well. You are aware of it. That is known as illness. You got my point. Now once when you become ill, what do? In your school time, in your college time, you take a leave. Which leave? You take disease leave or ill leave or sick leave. Which leave you apply? You apply a leave now to your principal, your teacher, your dean, whatever. That I'm what? I am diseased, ki I am ill, ki I am sick. What do you say? This is a disease leave or ill leave or sick leave? I'm asking you, it is a sick leave. So whenever you are ill now, you become socially dysfunction. Socially you will not do your job. Whatever is your job. Your job, you are a student, your job is to study. You go to school, you go to college, you go to some office to do some job. If you are a businessman, you go to your shop, whatever. So socially you are not functional. So because you are ill, you are aware that I am ill, and socially you don't want to do your social responsibility. So you are sick. You are sick. Sometimes even on being ill due to the pressure, we go to our job. We don't take leave. So at that time we are ill but not sick. You got my point. Once we are socially dysfunction. Socially we are not doing our responsibility. If we are a student, we are not going to our school, our college. If we are working in some office, we are not going to our office because we are ill. So we are sick at that point because socially we are absent. We are absent socially. We are not doing our responsibility. Give me a thumbs up if you got the difference between the two. What is the disease? What is the illness? What is the sickness? You got it? You got it? Say yes if you got it. So what is a disease? What is illness? And what is sickness? What is sickness? Can any one of you define? Now PSM is a subject which is very, इसमें छोटी छोटी बारीकियां हैं. Right? Someone may explain you the difference, then you will never forget. You got my point. So what is a disease? Can you tell me? Any one of you? Any one of you? Deepak, Mishab, Aditya, Gaurav? Yes. So what is a disease? So disease is physiological or psychological. Psychological dysfunction. You are not functioning properly physically, psychologically, you have disease. Now you may be aware, you are not aware. If the disease is very mild, sometimes we are not aware. But the point when we are aware of our disease, at that point we become ill. Because we are aware that we are not well. We are not well, we have symptoms of it. Right? So we are ill. Now after becoming ill, we become socially dysfunction. Right? Initially we were physically and psychologically dysfunctional. But socially we were working. We were going to school, college, because we were not aware that we are ill. Once the point when we come to know that we are ill, socially we become absent. We become dysfunctional socially also. At that point it is sickness. Right? We apply sick leave. I am sick. I don't say I have a disease. I don't say in my leave that I am having an illness. I say I am sick. Sick means socially I will be absent because I am not feeling well. That's why socially I will be absent for few days. Whatever. You got my point. So in the health, three things were there now. Physical, mental and social well-being. So physical and mental dysfunction हुआ तो disease, लेकिन social dysfunction हुआ तो illness. Social dysfunction हुआ तो sickness. The three components of the health: physical, mental, social. Everyone give me a thumbs up. Correlate the two definitions: the health and the disease. You got it? You got it? Can we go ahead? Can we go ahead? So that is the definition, the three definition: disease, illness, sickness. Okay, I guess you got it. Now, what is the natural history of a disease? In the natural history of a disease, there is pre-pathogenic phase, then there is pathogenicity, and there is two endpoints, either the recovery or the death. Recovery, disability or death, three endpoints are there. So whenever inside the body any disease is there, before symptoms, the disease, the organism multiply inside the body. Just multiply. If it is a bacteria, virus, fungus, whatever it is, it will multiply. But currently I don't have any symptoms. So I am in pre-pathogenic phase. Pre-pathogenic phase. Once I will have the symptoms, it will be pathogenic phase. and after that three endpoints can happen. If I take the treatment, recovery will happen. If I take delayed treatment, not early treatment, disability can happen. If I take no treatment, death can happen. So these are the three endpoints of a disease. If you have disease, one of the three things will happen. After the disease, one of the three things will happen. Either you will be recover if you take proper treatment, or the disability can happen to the patient, or death can happen if no treatment is taken and the disease is fatal. Give me a thumbs up. So if you got these points, all these points, listen now everyone here. If you got all these points now, so this is the pre-pathogenic and pathogenic phase. Let me tell you the topic of the today, levels of prevention. We want to prevent the disease. There are 4 levels of prevention: primordial, primary, secondary, tertiary. What do you mean by that? To understand the meaning of the 4 level of prevention, primordial, primary, secondary, tertiary, you have to understand this. Please understand this. We all are living a normal life. Of course, we all are living a normal life. Currently, I don't have any disease. I think so. I'm not ill, because if I'm having any disease also, I'm not aware of it, right? So currently, we all are leading a normal life, right? But in our environment, multiple risk factors are present. In the air, bacteria, virus, fungus, everything is present. The risk factors are present which can cause the disease. Right, I'm eating a diet, I'm eating cholesterol in that, right? So I can have cardiovascular disease in future. So risk factors are there in the environment, in the air, in the water, in the food. Risk factors are always present. We are exposed to millions of risk factors, right? So at some day we can have a disease because of the risk factor. So initially the disease will be in early stage, then gradually the disease will progress to late stage. And if still no treatment is taken, the disease will progress to disability. And still if no treatment is taken, it will lead either to recovery or to death, right? So this is the complete how the disease happens. This is the complete cycle. Give me a thumbs up if you got it. Now at what level we can prevent it, please understand. Very important. If you are preventing the risk factor even to get exposed, it is known as primordial level of prevention, the best prevention. The best prevention. If risk factor is present, but you are preventing the disease to happen because of the risk factor, it is known as primary. The second best. Now what do you mean by, now students always have confusion between primordial and primary. What do you mean by primordial? What do you mean by primary? Students always have confusion. Listen. Imagine a person who don't smoke. आज तक उसने smoke किया ही नहीं है, right? The person is in front of me. A person is in front of me. So I'm counseling the person. You are not smoking, very good, and even you don't smoke in future also. The person is saying, madam, I don't smoke. I know. I'll say, I know you don't smoke, but I'm counseling you, even in future also you don't smoke. And you are doing the good job. The smokers are not good and they have diseases, whatever. I'm doing the counseling, right? So the risk factor is not present. The person is not smoking. The risk factor for lung cancer is absent, and even I'm eliminating it. So the person who don't smoke, मैं उसी को काउंसिल कर रही हूँ कि हाँ बढ़िया काम कर रहे हो, मत स्मोक करो, कभी करना भी मत. तो ये मैं primordial level of prevention उसको दे रही हूँ. Imagine another person who already smoked but doesn't have lung cancer till now. Who smoke but doesn't have lung cancer till now. मैं उसको counseling कर रही हूँ. I'm doing the counseling of that person. So I'm counseling that you are already a smoker. Okay, but till now you are lucky you don't have lung cancer. But in future, if you continue smoking now, you can have lung cancer at any point of your life. So leave smoking. So the risk factor is already present, but the disease is absent. You got my point? And I'm counseling that person. So this is known as primary. You got my point? I guess I tried hard. Give me a thumbs up. You got my point? So the person who don't smoke, uski counseling karna is primordial. The person who already smoke, uski counseling karna is primary. Both doesn't have disease. Give me a thumbs up. So if risk factor is absent and disease is also absent, right? That at that point, if you are doing a counseling, at that point you are doing a prevention, it is known as primordial. So that is no smoking, no lung cancer. The person is not smoker. But if the person is already a smoker, risk factor is present, but still the disease is absent. उसको lung cancer नहीं हुआ है, risk factor present है, but lung cancer नहीं हुआ है. The risk factor is present, but the disease is absent. That level you are doing the prevention is known as primary. Which is best? Among the two? Among the two, primordial is the best. Primary is the second best. Give me a thumbs up. I tried. At least I tried. You got my point? So if risk factor and disease both are absent and you are preventing at that point only कि even risk factor ही नहीं आने दो, न रहेगा बांस न बजेगी बांसुरी, risk factor को ही हटा दो, जड़ से उखाड़ दो. So that is the primordial. अगर risk factor already present है लेकिन disease नहीं है ना कभी अभी तक, so you are Preventing at that point, it is known as primary. Now see, you will understand it. So even you are removing the risk factor from the normal life, it is primordial. But if risk factor is present, but disease has not happened, at that point it is known as primary. You got my point? So these two preventions are the best prevention, the best. You got my point? Coming on the third level of prevention. Imagine the lung cancer already happened. The person is already a smoker. You consult. Initially the person was non-smoker. You consult कि कभी smoke करना भी मत. You have given the primordial prevention, but he started smoking unfortunately. ठीक है? He started smoking. You again consult कि leave smoking. It will cause you lung cancer. Still person is, you tried primary also, but उसने सुना नहीं. उसने continue किया smoking. अब उसको lung cancer हो गया. But the cancer is an early stage. अभी छोटा सा cancer है, a small cancer. So what you will do? You will ask the person to take treatment immediately, do the surgery, chemo, radio, whatever possible, do it so that disease do not progress to late stage. So you are giving the prevention between early and late, early stage of disease and late stage of disease. You got my point? So it is known as secondary level of prevention. It is known as secondary level of prevention. At least disease हो गया है, ठीक है, हो गया, लेकिन early stage में ही उसको halt कर दो. Do not let the disease to go in late stage. You are halting at early stage. Right, so that is known as secondary. Secondary is always diagnosis and treatment. You do the early diagnosis, you take the treatment. It is always about treatment. The disease has already happened, but still it's in early stage, not in late stage. तो पर्सन ने ट्रीटमेंट भी नहीं लिया, उसने बोला नहीं मेरे को ट्रीटमेंट नहीं लेना, आई विल नॉट डू द सर्जरी, कीमो, रेडियो, ठीक है. अल्टीमेटली द पर्सन विल हैव डिसेबिलिटी, द पर्सन हैव परमानेंट डिसेबिलिटी, एंड डिसेबिलिटी में जो आप प्रिवेंशन करते हो दैट इज टर्शियरी ट्रीटमेंट. द टर्शियरी. नाउ लंग कैंसर में तो डिसेबिलिटी नहीं होता है, लाइक इन पोलियो और इन अदर द पर्सन विल बिकम हैंडीकैप परमानेंटली. सो एट दैट टाइम यू प्रोवाइड फिजियोथेरेपी एंड ऑल कि अब ठीक नहीं होगा, द पर्सन विल नॉट बिकम क्योर्ड एवर, लेकिन जो हम कर सकते हैं वो कर लो टू ईज द लाइफ. So the worst prevention is the tertiary, that is rehabilitation. You are just doing rehabilitation, that's it. Give me a thumbs up if you got it. The 4 levels of the prevention. So can you tell me what are the 4 levels of prevention? Here the risk factor is there. Okay, let me tell you. Here we all are leading a normal life. We didn't have any disease. So in the normal life, risk factors are present in our environment, food, water. Due to the risk factors, we can have disease. Initially early disease, and early disease will progress to late disease, and late disease will ultimately progress to disability, permanent disability which cannot be cured. Disability is something which cannot be cured. So at what level you can provide prevention to your population? So even I will prevent the emergence of the risk factor. Risk factor ही नहीं आने दूं मैं उनकी लाइफ में. So that is, I can provide the primordial level of prevention, the best prevention, the best prevention, right? If risk factors are already present, but I am preventing them to cause the disease, it is known as primary. It is known as primary level of prevention. If disease already occurred, but early stage, not late stage, so I am providing treatment, aggressive treatment to the person to halt it there only. So that is known as secondary prevention. Secondary prevention. And after late disease, if patient is not taking the treatment, already disability is happening. So that is known as tertiary. Everyone give me a thumbs up. I tried. Yes. Osama, Rakesh, Gaurav, Gajanan. You got it? Say yes, everyone. You got it? Now, being a doctor, we all are doctors, right? So, being a doctor, we always have an opportunity to give the primordial prevention to our patient. Now, being a doctor, what happens now? We study for so many years. We get so frustrated. So, whenever we do the actual practice, whenever patients come to us, we deal with the patients. There is already, no, you will say, ma'am, healthy population will not come to me. If you are a doctor, only patient will come to you, right? Only patient will come to you who already have early or late disease, right? So treat that disease. Just suppose I am a gynecologist and patient or obstetrician, the patient is pregnant and the patient, not a patient, the subject is the patient, pregnant, and the subject is coming to me. So I will deal with the pregnancy, all the complications, all stuff, right, with the pregnancy. But I can give advice for other diseases. For example, if that subject is obese, right, and physically inactive life, sedentary life, so I can advise my that lady that you must lose your weight because you have overweight, right? You are physically inactive, you are hypertensive also, so you already have multiple risk factors of cardiovascular disease. Currently, you don't have any disease, but I can see multiple risk factors inside your body which can lead to you in future cardiovascular disease. So you must lose your weight, you must start exercise, you must take low salt diet, you must take low cholesterol diet. So I am reducing the risk factors. So I can provide the primary prevention to my patient. You got my point? So in the same way, there is a male patient in my clinic for some other disease, for cough, cold, anything. So I will treat that disease. But I can see the male is a smoker. The student is a smoker, right? So I can advise that don't smoke. Don't smoke. Leave smoking. In future, you can have lung cancer. So I'm providing the primary. The risk factor is already present. और if the person is not smoker, I am, उसी को exaggerate कर रही हूँ कि तुम smoke नहीं करते, लेकिन अच्छी बातें नहीं करते, future में भी मत करना. So I can provide the primordial and primary. My point is that being a doctor, it is the misconception that our job is only to treat the patient. Being a doctor, our job is to treat as well as prevent diseases. Treat the diseases which already happened and prevent the diseases which can happen in future, right? Layman, the non-medicos cannot see the risk factors, but you are educated stuff now. You have studied the risk factors of all disease. If risk factors are present in any one person and you can see them, the person is having this. These all are the risk factor of this disease. Currently person don't have that disease, but in future he or she can have. So it's your job to advise that person. You have an opportunity in your OPD, right? So always give 15 minutes to every patient. It is not hurry कि just 2 minutes में हर patient को लिखते जा रहे हैं, हाँ ये ले लो वो ले लो. No, give proper time to each and every patient. Take a proper history, right? History concerned to your disease. Now whatever is your specialty, you are a dermatologist, you are an obstetrician, you are an orthopedician, whatever. So whatever is your specialty, deal with that particular disease. But take a proper history also to see other risk factors for other diseases. It is also your responsibility to prevent the diseases in the society, right? ऐसा नहीं सोचना है कि होने तो बीमार आएगा तो अपने ही पास ना, तो अपना ही फायदा है, ऐसा नहीं है. No, you have to prevent the diseases. You have to treat the diseases, and equally you have to give your best efforts to prevent the diseases. Give me a thumbs up if you got my point. So this is how we can do the prevention. So let me give you the details of all 4 levels. You already got the overview. Let me start with the first one, the primordial. What is primordial? Can anyone tell me? Even we are preventing the emergence of the risk factor. Risk factor को आने से ही खत्म कर दो. न रहेगा बांस, न रहेगी बांसुरी. The best level of prevention. Even we are preventing the emergence of the risk factor. That is known as primordial. You got my point? So risk factor को ही हम eliminate कर रहे हैं. That is known as primordial, right? How you can do that? As I have told you, individual education, individually at your neighbors, you have many neighbors or any relatives, so you can advise them, even eliminate the risk factors in their life. They are not present and even eliminate them, right? Or you can do mass education on the TV, on the internet, on the radio. Mass education can be done, right? So many advertisements run by the government on the television, right, for the this primordial intervention, right? So that is individual education or mass education, the 2 ways we can do. So write down here 2 ways, individual education and mass education, the 2 types. Ultimately we have to educate that person, because we are medicos, we know it. You have to educate that person. The person is already not smoking, but you have to reinforce it. You are not smoking, good, you don't smoke. The person will say, madam, I already don't smoke, why you are saying this? I know you are not smoker, but I am reinforcing that idea in you. You are doing a good job. Don't smoke ever. So that is primordial. I am educating that person, because if you smoke, you can have lung cancer. That is the idea, right? So that is only by education, the individual and mass. That's it. Coming on the primary. The primary, I have already taught you the risk factors are already present in the environment, but disease is absent. At that level, you are intervening. The risk factors are already present in the environment, but the disease is absent. At that level, you are intervening. That is primary. That is action taken prior to the disease, but after the risk factor. So that is second best level, right? How we can do that? We can do that by 2 things. We can do that by 2. You have to tell me the modes of intervention also, how you can do that. Number 1, you can give health promotion. Health promotion is non-specific. What is health promotion? General advice. We all should take good diet. We all should exercise. The general advices. And specific protection is for some specific disease. For example, health promotion में ये सब आ जाएंगे. Good lifestyle, good environmental protection, good diet, ये सब. लेकिन specific protection में we all are immunized, right? Do you have vaccine of BCG in your childhood? Yes, you all have. Do you have vaccine of OPV? Yes. Do you all have vaccine of DPT? Yes. Your mother, your parents have done vaccination of yours, of mine. Every one of us is vaccinated nowadays, right? Why we are vaccinated? Because we don't have that diseases in future. But the risk factor is already present in the environment now. Environment में TB is present for the BCG TB, right? Environment में polio is present, diphtheria, pertussis, tetanus, everything is present in our environment. So risk factor is already present, but the disease has not happened. At that point, we are giving vaccine. So vaccination or immunization is primary mode of prevention. Give me a thumbs up if you got it. You got it, Ujjwal, Gaurav, Hakeem, Osama. What I'm saying a big thing. I'm saying vaccination, all vaccine, कोई भी दुनिया का वैक्सीन हो, या immunization, कौन से लेवल का prevention है? Immunization और vaccination one and the same thing. Which level of prevention? Is it primordial or primary or secondary or tertiary? So we give vaccine or immunization to prevent some disease. Disease has not happened. To me, my mother has given me DPT, OPV, BCG, everything. I don't have TB, I don't have polio, I don't have diphtheria, pertussis, tetanus because I am vaccinated for all these diseases. You are also vaccinated. So, but the risk factor is present in the environment. In our environment, all these bacteria, viruses are already present. Risk factor present, but disease is absent. So this is primary level of prevention, not primordial. You got my point? So you have to understand the things. So, but for specific disease, we have specific vaccine. BCG will prevent me only against TB. BCG will not prevent me against polio. Right, OPV will prevent me only against polio, not against diphtheria. You got my point? So specific vaccine for specific disease, that is known as specific protection. You got my point? You got my point? You know what is fortification? Fortification of the food is done, right? For example, nowadays we all eat salt in our food, right? But we eat the salt which is iodized. Government has made the norms that all salt should be iodized. Right, iodine होना चाहिए उसमें. So we fortify the salt with iodine. Why? Because in our country many people have goiter and we want to prevent it. Goiter is due to iodine deficiency. So we want to provide iodine to all the population throughout the country. अब घर घर जाके तो नहीं बांट सकते ना कि तुम भी ले लो, तुम भी ले लो, तुम भी ले लो. तो उसको किसी ऐसी चीज में दे दो जो सबको ही खाता हो. अब नमक तो ऐसा है कि नॉर्थ इंडियन हो, साउथ इंडियन हो, ईस्ट हो, वेस्ट हो, एवरीवन ईट सॉल्ट, राइट? सो सॉल्ट को fortify कर दो आयोडीन से. So automatic iodine will reach each and every home, each and every population. So this is known as fortification. Fortification, that is the idea behind. We do the, nowadays we are thinking double fortification because in India anemia is also very common, iron deficiency anemia. So we want to fortify the salt with iodine as well as iron. It is the idea. Nowadays double fortified salts are available. So घर घर जाके iron हम नहीं दे सकते, but we will give it in salt. So salt will go everywhere. Along with the salt, iron will reach everywhere. You got my point? That is the idea behind fortification. Again, fortification is primary level. In the primary, it is specific protection. So iodine will prevent only goiter. Iron will prevent only anemia. So specific thing will prevent specific disease. You got my point? Supplementation, right? Uses of condoms, right? During sexual intercourse. Again, it is a primary, right? Pregnancy have not happened. The pregnancy is considered as a disease. It is not a disease, but we are considering the conceiving pregnancy is a disease. And sexual intercourse is the risk factor. So risk factor is present, but the disease is absent. The sexual intercourse is present, but pregnancy is absent. So we want to intervene at that level using condoms or any contraceptive. The barrier method. So all the barrier method, the male condom, the female condom, the diaphragm, the vaginal sponge, all things will come here. So that is primary. Primary means specific protection. You got my point? Specific protection. Everyone give me a thumbs up. I tried hard. So there are ultimately what I mean to say, primordial and primary we have done. Primordial ke two modes of intervention. Education. Individual education and mass education. The ultimately you have to educate the person. Right, that is primordial को बचाने के दो ही तरीके हैं. इंडिविजुअल एजुकेशन करो या फिर इंटरनेट और टेलीविजन पे मास एजुकेशन करो. दैट्स इट. प्राइमरी के लिए दो तरीके हैं, या तो हेल्थ प्रमोशन नॉन स्पेसिफिक या स्पेसिफिक प्रोटेक्शन. स्पेसिफिक प्रोटेक्शन में बेस्ट एग्जांपल है वैक्सीन. स्पेसिफिक वैक्सीन फॉर स्पेसिफिक डिजीज, राइट. फोर्टिफिकेशन, स्पेसिफिक फूड आइटम फॉर स्पेसिफिक डिजीज, राइट. कॉन्डोम्स only for pregnancy. So health promotion and specific protection, these are the two ways by which we can do primary prevention. So I have taught you two ways by which we can do primordial prevention and two ways by which we can do primary prevention. Give me a thumbs up. You have to learn the mode of intervention also. You got it? You got it? Okay. Coming on secondary. Secondary क्या होता है? The disease already happened, but still the disease in early stage, not in late stage. Disease is in early stage, not in late stage. So at that point, whatever you can provide is the secondary level of prevention. So we halt that progression of the disease. We want to halt it. Halt का मतलब stop. We want to stop the disease at that level only, at the initial stage. We do not want to have the complication of that disease, the late stage. We do not want that, right? So it is very expensive and less effective level of prevention. It is not good, right? If you have done this, now this will not happen, right? But you have not done this properly. Patient is not following. This is not done. So patient already have the disease. Now you have to provide treatment which is costly. which is costly, right? How you can do that? यहाँ पे भी दो तरीके हैं, इसके भी दो तरीके हैं, इसके भी दो तरीके हैं, इसके भी दो तरीके। इसके दो तरीके क्या हैं सेकेंडरी में? अर्ली डायग्नोसिस एंड ट्रीटमेंट. You do early diagnosis and you do treatment, right? So like for malarial parasite we do peripheral smear, right? So घर घर पेश वो जाता है, the male worker, you know we have male worker and female worker at PHC. The male worker will go to home in a village. Whosoever having a fever, he will take a sample, blood sample, and make a peripheral smear and look for the malarial parasite. Now it is a difficult job. Fever already present है patient में, sample सिर्फ किसका लेना है हम? जिनमें fever है. Fever मतलब symptom, symptom मतलब disease. तो पेशेंट ऑलरेडी हैव अ डिजीज. नाउ द ओनली थिंग वी आर डूइंग अर्ली डायग्नोसिस कि मलेरिया तो नहीं है, मलेरिया है तो फटाफट ट्रीटमेंट दे दो. यू गॉट माय पॉइंट? सो द डिजीज इज ऑलरेडी प्रेजेंट, द डिजीज इज ऑलरेडी प्रेजेंट. एनीवन हैविंग कफ, द पेशेंट हैविंग कफ, हम फटाफट उसका एसिड पास स्टेनिंग करते हैं, एसिड पास स्टेनिंग ऑफ द स्पूटम. यू गॉट माय पॉइंट? टू सी अगर टीबी है क्या, कफ है मतलब डिजीज ऑलरेडी है, ऑलरेडी डिजीज है. लेकिन द ओनली थिंग वी वांट टू डायग्नोस इट अर्ली by doing the diagnostic test and then after diagnosis providing treatment as soon as possible. So early diagnosis and treatment, ठीक है? That is the thing. Now coming on the last level, the tertiary level. The tertiary level. Tertiary level में already disability हो चुका है. The late stage is already there. Disability is already there. We want to reduce disability. That's it. Reduce or limit disability. Disability already happened. अर्ली क्या, लेट क्या, ऑलरेडी पेशेंट को डिसेबिलिटी है, अब वो क्योर नहीं होगा. यू कैन नॉट क्योर इट. पर्सन को कभी भी गुड हेल्थ नहीं मिलेगा, ऑलवेज हेल्दी नहीं होगा वो. बट ओनली थिंग यू कैन लिमिट इट. यू कैन लिमिट इट बाय टू थिंग्स, डिसेबिलिटी लिमिटेशन एंड रिहेबिलिटेशन. डिसेबिलिटी लिमिटेशन मतलब अगर पेशेंट है पोलियो, यू डू फिजियोथेरेपी. अब पोलियो इज इनक्योरेबल, पोलियो हो गया ना, अब वो ठीक नहीं होगा. इमेजिन अ मदर, अ कपल हैविंग अ स्मॉल किड. द कपल हैव अ चाइल्ड and you are asking the couple to give OPV to their child, right? You are asking the mother to give OPV to their child. The mother is saying no, I don't give it, right? And they are not following your advice. So you tried primary, you tried giving vaccination, but it is not working. So their child have polio, right? At early stages you ask them for the treatment, they are not following. Now the child is already paralytic, right? Now at late stage what you can offer, the best you can offer is the physiotherapy. That's it. So when primary, primordial, secondary, nothing is working, the end is the tertiary. You got my point? So resting the limb in the neutral position. These are the disability limitation. और rehabilitation में you provide crutches for the polio. पोलियो को चलने के लिए, you know crutches, जो crutches हम provide करते हैं जिसके सहारे से वो चलता है, right? You provide reconstructive surgeries, right? And you provide schools for the blind, schools for the polio. You provide jobs for the polio person. ये सब rehabilitation हो गया. So that is tertiary level of prevention. You got my point? Everyone give me a thumbs up. Everyone give me a thumbs up. So primordial, primary, secondary, tertiary. Primordial risk factor को ही emerge होने से बचाता है. Primary disease आने से बचाता है. Risk factor is present but disease is absent. Secondary complications को होने से बचाता है. The disease is present but complications are absent. Tertiary further complications होने से बचाता है. So that is the way we prevent the diseases at various levels. Yes, spectacles for the vision loss. Yes, Gaurav. It is also an example of tertiary. Now you have to tell me two modes of preventing. You have to tell me primordial, primary, secondary and tertiary. Please tell me two ways of modes of intervention of each of them. The two, total 8 ways. Who will tell me? Tell me. You have to learn it because there are many MCQs based on the modes of intervention. So what are the 2 ways of primordial? The primordial is education, individual education and mass education. By educating the person, you can prevent primordial at primordial level, right? Primary में भी 2 हैं. Health promotion is non-specific, but specific protection जिसमें वैक्सीन आ जाएगा. Specific protection is specific. Give me a thumbs up. सेकेंडरी में भी 2 हैं, डायग्नोसिस, अर्ली डायग्नोसिस एंड ट्रीटमेंट. फर्स्ट डायग्नोस इट एंड गिव द ट्रीटमेंट. इसमें भी 2 हैं. और टर्शियरी में भी 2 हैं, डिसेबिलिटी लिमिटेशन like physiotherapy and rehabilitation, providing schools and jobs and all. Rehabilitation. Give me a thumbs up. Everyone give me a thumbs up. So learn 2. These are known as modes of intervention at each level. Now if you got it, I will show you many MCQs based on that, right? I will ask you. So you have to write your answer. In each question, listen, I will ask you 15 questions now, one by one. In each question, you have to tell me 2 things. Number 1, out of primordial, primary, secondary, tertiary, what is the level of prevention we can offer? First thing. And whatever you say, just suppose you are saying, ma'am, it's secondary, it's primary, whatever is your answer, which is the mode of prevention out of the two? You have to tell the mode of prevention also. You got my point? So tell me two things: the level of prevention you can offer and the mode of intervention. दोनों चीज बतानी है आपको. Read the question. Read the question. Let me read the question for you. There is a patient with fever and cough. Patient को already fever भी है, cough भी है, right? Fever and cough for 3 weeks, and patient is coming to the DOTS clinic for the sputum. And you are taking the sputum of the patient. What you are doing? Which level of prevention you are providing? The patient already have fever, the patient already have cough, the patient is coming to the DOTS clinic, and you are taking the sputum of the patient for testing TB, for acid fast staining. So primary. Gaurav is saying primary, Osama is saying primary. Is it primary? Gaurav, Osama, the disease is already present. Come on, guys. Yes, Nitin, it's secondary. It's secondary. Yes, the disease is already present. Primary में disease नहीं होता. Osama, Gaurav, the patient already have cough and fever, so disease तो present है ना. But you अब disease present है तो you want to limit it early, not late. So उसके लिए आप early diagnosis कर रहे हो, right? So it is secondary level of prevention. Secondary level में भी you are not providing treatment, just आप sputum testing कर रहे हो. Secondary में दो चीजें हैं ना, early diagnosis and treatment. Currently you are doing diagnosis, not treatment. So I will say, ma'am, it's secondary level of prevention. उसमें भी early diagnosis. So that should be your answer. So your answer is early diagnosis in the secondary level of prevention. This is your answer. Give me a thumbs up. Yes, Tejaswini. Give me a thumbs up. Now next question. मुझे सबको ही right चाहिए. Think before you answer. Think. The patient is already sputum positive for acid fast bacilli. Already positive. The patient is diagnosed case of TB. Come on. Already diagnosis हो गया. Right. Now under RNTCP program we have given CAT 1 and we have started the drugs. We are giving the drugs to the patient. Intensive phase drugs. हम treatment देना शुरू कर रहे हैं. So we are giving the drugs. What level prevention you are doing? The patient is already TB. So is it primordial? Is it primary? Is it secondary? Is it tertiary? What it is? Who will give me the answer? Who will give me the answer? The patient is already having the TB. It is already diagnosed and now you are giving the drugs. Now you are giving. Yes, Nathan. Again. So it is, yes, Gajanan. It is secondary. It is secondary. Mode of intervention क्या है secondary में? Secondary में दो चीजें हैं, diagnosis, treatment. तुम diagnosis कर रहे हो कि treatment दे रहे हो यहाँ पे? यहाँ पे हम treatment दे रहे हैं. So again it is secondary level of prevention, but here we are giving early treatment. Right? पिछले question में और इसमें क्या difference है? In the last question and this question, what is the difference? In the last question we were doing diagnosis. In this question we are giving treatment. Both are secondary level because both the patient are already diagnosed with TB. Give me a thumbs up. Give me a thumbs up. Yes, it is secondary. Secondary में भी treatment है. No, not tertiary, Tejaswini. It is secondary. Tertiary में the patient already late stages को भी cross कर चुका है. ये late stages cross नहीं किया है, patient को TB है, and you are giving the drugs for the TB. You are just giving the treatment, right? In the secondary, Tejaswini, we are having two things now: early diagnosis and treatment. The diagnosis part is over. You can see sputum is already positive. The diagnosis is over. The next you are giving the treatment. So secondary में ही you are giving the treatment. So it is secondary, not tertiary. You got it? You got it? Say yes. You got it? Okay. So the answer is secondary level of prevention and the mode of intervention is treatment here, not diagnosis. It's treatment. I guess you got it. Again, let me revise you before asking the third question. Primordial, primary, secondary and tertiary. In each of them, you have two modes of intervention. Primordial means it's education. Education to the individual, education to the mass. Mass, complete population. Primary maybe you have two. What are the two ways of primary prevention? It's health promotion. Health promotion is non-specific and specific protection is for specific disease, right? Secondary maybe you have two things: early diagnosis and treatment. Tertiary maybe you have two things: disability limitation and rehabilitation. So the first job is to identify इन चारों में से कौन सा है. So always look at the clues in the question. Listen. If risk factor is absent and disease is of course also absent, it is primordial. You got my point? If risk factor is present but disease is absent, it is primary. You got my point? If risk factor is present, disease is also present but in early stages, not in late stages, it's secondary. If both are present but already complications have happened, it is tertiary. Give me a thumbs up. I tried hard. Everyone give me a thumbs up. Everyone. Yes. So can we go ahead? The third question. Dopamine, definitely I will take a lecture on MCH also. Don't worry. Don't worry. Right? Anyways, can you tell me the answers of this question? So a patient with fever and chills. एक patient है, उसको fever भी है, chills भी है. Right? Coming to the malaria clinic, malaria OPD, and you are taking a blood sample for the peripheral smear of malarial parasite. MP is malarial parasite. You are taking the blood sample of the patient. So what basically you are doing? Imagine there is a patient in front of you. Patient is saying, doctor, I'm having fever. I'm having chills. Patient is saying to you. So you are saying, okay, you have fever and chills. Let me take your blood sample and look for the malarial parasite on a slide. So you are doing this. So basically it is what? Is it primary, secondary, tertiary, primordial? What level of prevention you are giving? The patient already have fever and chills, so disease to present. Disease is already there, right? So if disease is already there, patient already have fever and chills, disease is already present, so it is secondary level of prevention. पहले मुझे level बताओ. Yes, very good. Secondary level. Yes, Hakeem. Secondary level में you are doing early diagnosis by making a slide. Yes. So secondary level में early diagnosis, you all are right. Give me a thumbs up. सब लोग thumbs up दो. So it's secondary level of prevention in which you are giving early diagnosis. Yes, very good. The next question, same question. ये भी question same है. Same patient with fever and chills, again coming to the malaria clinic, right? And you are directly giving the treatment, right? You are giving presumptive treatment. You got my point? So this is the patient coming to your clinic again. Doctor, I'm having fever and I'm having chills. You are saying, okay, you have fever and chills. You take this treatment. You are presuming the patient is having malaria. You are not doing diagnosis, right? And you are directly giving the treatment. So again, this is secondary level of prevention, but this time it's treatment. It's not tertiary, Sunanya. It's not tertiary. Don't get confused. ये सारे question तुम्हारे PY क्यों हैं? And students get confused. No, it's not tertiary. It's still secondary. It's still secondary, but in the secondary, two things are there, na? Early diagnosis or treatment. In the last question, you were making peripheral smear, you were doing early diagnosis. This time, you are not making peripheral smear, you are directly giving the treatment. Presumptive treatment, you can say. You are presuming. So it's again secondary level of prevention, but it's treatment. Early treatment. You got my point? It's not tertiary. Patient को कोई permanent disability नहीं हुआ है जो मैं tertiary बोलूँ. फीवर है, चिल्स है, ठीक हो जाएगा, लेकिन इसकी वजह से उसको सेरिब्रल मलेरिया हो जाए तो वो हो जाएगा उसका कॉम्प्लिकेशन, वो हो जाएगा टर्शरी. बट इट्स नॉट टर्शरी करंटली. तो स्टिल द आंसर इज सेकेंडरी. आंसर इज स्टिल सेकेंडरी, लेकिन सेकेंडरी में अर्ली डायग्नोसिस नहीं है, इस बार सेकेंडरी में ट्रीटमेंट है. लर्न द टू मोड्स ऑफ इंटरवेंशन ऑफ ईच लेवल, वो ज्यादा इंपॉर्टेंट है. यू गॉट माई पॉइंट? यू गॉट माई पॉइंट? आई विल अपलोड द नोट्स on the Telegram. Ujjwal, please remind me once. You can send me a personal message also on the Telegram or WhatsApp where you are connected with me. So send me a personal message. I will send you the notes also. Right? Don't worry. So the next question. This I also do this. Right? The person sleep inside a bed net. In my room, on my bed, I am having a bed net. Right? Why I am having a bed net? I don't want mosquito to bite me. Right? If I am having, so this is my bed. This is the bed. Right? This is the bed of a person, and around the bed the person is applying a bed net and then sleeping here. Then the person is sleeping here. Why the person is doing so? Every night the person is doing so. Why? So is it primordial, primary, secondary, tertiary? We apply bed net for the mosquitoes. So the mosquitoes are present in the air. The mosquitoes are present. That's why we are applying the bed net. Now the mosquitoes are present in the air, but we do not want the mosquito to come and bite us. Right? So the risk factor is present, but the disease is absent. So it is primary, not primordial. Many students confuse it with primordial. It is primary because the risk factor is present in the environment. You can't say कि mosquito ही नहीं है. Mosquito ही नहीं है, वो हो गया primordial. लेकिन mosquito है, malaria नहीं है, तो वो हो गया primary. Mosquito तो है ना, मेरे रूम में बहुत सारे mosquitoes हैं. In my room there are multiple mosquitoes. So whenever I am going to sleep, I am afraid that these mosquitoes will bite me and I will have malaria in future. Right? I do not want that. I will apply a bed net and go to sleep. Right? So mosquitoes are present, but they cannot bite me. Right? So this is primary. प्राइमरी में भी दो होते हैं ना, कौन सा प्राइमरी में कौन है? ये हेल्थ प्रमोशन की स्पेसिफिक प्रोटेक्शन. बाय अप्लाइंग बेड नेट आई कैन प्रिवेंट मलेरिया बट आई कैन नॉट प्रिवेंट टीबी. बेड नेट लगा के सोऊंगी तो मुझे टीबी नहीं होगा, पोलियो नहीं होगा, ऐसा नहीं है, कोरोना नहीं होगा, ऐसा नहीं है. राइट? आई कैन हैव दिस, ओनली थिंग आई कांट हैव मलेरिया. राइट? सो इट इज स्पेसिफिक प्रोटेक्शन. सो प्राइमरी में भी इट्स स्पेसिफिक प्रोटेक्शन. So first say the mode of intervention, primordial, primary, secondary, tertiary, and then inside that what is the mode of intervention? Primary में you have two options, health promotion, specific protection. Health promotion is general, non-specific, and specific protection is against a specific disease. तो बेड नेट अप्लाई करने से जनरल सारी डिजीजेस रुक जाएंगी ऐसा नहीं है, सिर्फ मलेरिया नहीं होगा. सो इट इज स्पेसिफिक प्रोटेक्शन. So say it complete. Say it, ma'am. It's primary level of prevention, and it is specific protection. In that, the mode of intervention. So this is your complete answer. Yes. So it's primary level of prevention और उसमें भी specific protection है. Everyone give me a thumbs up. Everyone. You got it? The next question. The child is going to the immunization clinic for OPV vaccine. The mother is giving OPV vaccine to her child. So what actually the mother is doing? You are giving vaccine to the child. You are a pediatrician giving vaccine to the child. So what you are doing? OPV vaccine now. So polio is present in our air. The polio is present in the food. The polio is present in the water. So the risk factor is present. The virus is present. But the child do not have polio yet. The child do not have disease. So which level of yes, Tejaswini, Gajanan, Hakim. I want answer like this. Say yes. So it's primary, or primary may be specific. Primary level of prevention. The risk factor is present, but disease has not happened. So of course it's primary level of prevention. Primary may be it's specific against polio only. It is not specific. It is not non-specific. So it is specific. Specific. So answer is primary level, maybe specific protection, and you all are right. Very good. Very good. Very good. The next question in front of you. The next question, understand the question fast. Understand, a urine strip for the sugar detection. We are taking a urine strip for the sugar detection in the urine in a patient, right? To screen the diabetes in a community, right? Listen, I'm a doctor. I'm going in a colony. This is a colony. This is a community. There are various persons living in this colony, in this community. I'm a doctor. I'm going in this. I'm asking all the persons to give their urine sample in their test tubes. So everyone have provided urine sample and I have labeled their name vagera on that. I have labeled the test tube, name of the person and each of them, right? In each of the strip, in each of the urine sample, I'm putting a urine strip to see which among them are diabetes. Which among them are diabetes. The urine strip will show me. So basically what I am doing, for the diabetes, everyone is eating food. I mean the risk factors are present now. Anyone of us can be diabetic because we eat sweets. We are not physically very active. You got my point? So the risk factor is present but disease is absent. So you are providing, is it secondary or primary? Hakim and Tejaswani are saying secondary and early diagnosis. Is it secondary early diagnosis or primary specific protection? Let me confirm. It's secondary early diagnosis. You people are right. I got confused. Yes. It's secondary. It's secondary. The patient already have disease, the diabetes, and you are doing early diagnosis in them. In this community, some of them already have diabetes. And you are just putting the strips and see which strip is showing the change in color. So the strip which is showing change in color, that person already have diabetes. You are just want to detect it at early stage. You got my point? So you are doing early diagnosis. That is secondary level of prevention. The disease is already present. I got confused. Yes, you all are right. Very good. Very good. Smart students. You got it? The next question in front of you. In a village community was given health education, general health education, to prevent the spread of malaria. Just suppose there is a village. Let me draw a village. This is a village, the population inside the village. This is a village. I am going to this village. I'm standing here and I'm speaking. I'm giving a speech. I'm giving a speech to educate all these people. They are hearing my speech. I'm educating them regarding how to prevent malaria. How to prevent malaria. Malaria के लिए मैंने speech दिया. That is apply bed net before you sleep, right? Apply the insecticide on your, on your exposed areas. Wear full sleeves. Try to wear full sleeves dress. The dress with a full sleeve, so less mosquito bite, like that, right? Stagnant water मत रहने दो घर में. So general advices मैंने दिया. So what basically I am doing? I'm in my speech I'm educating the people. The mass education. एक bunch को मैंने एक साथ educate किया. You got my point? I'm doing mass education. But is it primordial or primary? Is it primordial or primary? The risk factor is already present. The mosquitoes are there in the village. That's why I'm giving the speech to them. So risk factor is present. So it's primary. It's primary, right? But only for malaria. In the primary, it's specific protection. Yes, you all are right. It's primary level and health promotion and specific protection. Ideally, it should be specific protection because it is only for malaria. अगर मैं general malaria नहीं, general awareness देती ना तो वो health promotion होता. You got my point? Village वालों को मैंने general health advice दी कि अच्छा खाना खाओ, अच्छी exercise करो, वो health promotion हुआ. लेकिन malaria के लिए दे रही हूँ तो it should not be health promotion, it should be specific protection. You got my point? The next question in front of you. 20-year-old male take chemoprophylaxis during an epidemic of meningitis, meningococcal meningitis. Meningococcal meningitis का epidemic चल रहा है, right? Epidemic like COVID का we have epidemic ना? We have epidemic या we have pandemic, right? So epidemic is emerging outbreak of a disease in a concise area. हाँ, so everyone is having. So the boy got afraid. अरे मुझे भी हो जाएगा meningitis. तो उसके पहले ही उसने कोई tablets ले ली. Like you know, जब COVID initially हुआ था, तो everyone have taken HCQ. to prevent them, to prevent the person is taking. The person don't have currently meningitis, but person want that it shouldn't happen. So the risk factor is present, but the disease is absent. So yes, it's primary and it's specific. Very good. So it's primary level, usme bhi specific protection. You all are right. Right. The next question. Very good question, I guess. Right. A student of a class of 5 year, a student of 5th class or 5-year-old child is there, right, is discouraged from adopting harmful lifestyle and smoking. एक 5 साल का बच्चा है, right, a small child is there and I'm counseling the child कि बेटा कभी भी लाइफ में ना, I'm counseling the child कि बेटा कभी भी लाइफ में स्मोकिंग मत करना, कोई भी हार्मफुल हैबिट मत अपनी लाइफ में बड़े होकर अडॉप्ट करना, बी अ गुड ह्यूमन, हेल्दी लाइफस्टाइल करना, अच्छी एक्सरसाइज करना, अच्छा डाइट लेना और स्मोकिंग कभी मत करना. एक 5 साल के बच्चे को आई एम डूइंग द काउंसलिंग. Right. So what basically I am doing? What basically I am doing? This 5-year child do not smoke. Right. So before the emergence of risk factor, I am eliminating it. So it is primordial. Yes. No, it's not primary, Rakesh. No, it's not primary. This one is primordial. Primordial mein you are giving individual education. There are two type of primordial. Na? Individual education, mass education. I am educating one child. So it is individual education. I will say primordial, individual education. Give me a thumbs up, everyone. It is not primary. You got it? बिकॉज 5 साल के बच्चे में कोई भी हार्मफुल हैबिट अभी है ही नहीं, आने से पहले ही हम रोक रहे हैं. अगर आ गई होती और फिर रोकते तो प्राइमरी होता, लेकिन आने से पहले हम रोक रहे हैं. सो इट इज प्रिमोडियल. इट इज प्रिमोडियल लेवल ऑफ प्रिवेंशन बिफोर द इमर्जेंस ऑफ द रिस्क फैक्टर. इट इज इंडिविजुअल एजुकेशन. गिव मी अ थम्स अप. सो बीइंग अ गुड डॉक्टर यू शुड डू इट टू योर नेबर्स, रिलेटिव्स, ऑल द एक्सपोज्ड पर्सन. यू गॉट माय पॉइंट? दैट इज द थिंग. दैट इज द थिंग. द नेक्स्ट क्वेश्चन. देयर इज अ चाइल्ड हु ऑलरेडी हैव पोलियो. द पोलियो इज प्रेजेंट. Already have polio. You are providing crutches to walk. You are just providing crutches to the walk. The child is paralytic. The child cannot walk. So you are providing the crutches so that with that help, the child can walk. So what basically you are doing? Yes, Gaurav. So the child already have polio. You are just providing crutches to walk. So you are doing rehabilitation. It's tertiary level of prevention. Tertiary level of prevention. So tertiary level mein it's rehabilitation. Why everyone is not participating? Only 2-3 persons are participating. I want everyone to say the answer. Now at max you will be wrong. It's okay. But at least participate. Right. So yes, it's tertiary mein rehabilitation. Very good. Very good. Okay. We are arranging a school for the polio persons. For the polio paralytic persons. Right. We are arranging a school for the child. All the polio child can come and study in that school. But polio is already present. Come on. So again it's tertiary. Again it's tertiary and you are just providing rehabilitation. So that the child will study and get a job in future, right? So it is tertiary. Tertiary में क्या? It's tertiary. You all are right. Nitin, Osama, Gaurav, Gajanan. Tertiary में it's rehabilitation. Say complete answer. Tertiary और tertiary में क्या? Is it disability limitation? No, it's rehabilitation. So say it's tertiary level and rehabilitation, vocational rehabilitation, right? So that's the thing. That's the thing. The same thing is there. Okay. All vaccines come under what? Any vaccine in the world comes under what? Is it primordial, primary, secondary or tertiary? All vaccines come under primary. Yes, all vaccines come under primary level of prevention और उसमें भी specific protection. I told you many times. Now we will solve some MCQs based on that, which are your PYQs of the NEET PG, AIMS, INICT, JIPMER, various questions I have taken from various exams. Can you read the question and tell me? In an area where fluorine-rich water comes, defluorination of water is done before supplying it to the population. We all get water. From where water come to your house? You all get water now. Water is supplied by the government. Every day we have a fixed time at which water come at our house, and we just collect it at somewhere in our tank or where, right? So before providing it to the population, the government is doing defluorination of the water. Right, because in that area the water have abundant of fluorine, which is not good for health. Abundant of fluorine can cause paralysis, right? It can cause many diseases. So government is doing defluorination of water before providing it to the population. So what basically the government is doing? Everyone is saying A. Is it primary level? Yes. The risk factor is already present. The fluorine is present in the water. But the disease, no one is having paralysis in the community. Government do not want that किसी को भी paralysis हो. So they are removing the fluorine. Yes. So it is primary level of prevention. You all are right. Yes. And it's health promotion. Gajanand, I will say specific protection ज़्यादा better है. Because health promotion में तो general हो गया ना. Specific protection, the government is giving protection only against fluorine, not against other things. Only against fluorine. So better Gajanan to go with specific protection. Although यहाँ पे पूछा नहीं है, लेकिन Primary, maybe I will go with specific protection. I guess you got my point. Give me a thumbs up. Right. So this is the explanation. You can read the explanation. Going to the next question. Can you tell me what is primordial prevention? Read the four options. Which among the following is primordial ka definition? Is it action taken prior to the onset of disease? कि prevention of emergence of risk factor? कि action taken to remove the possibility that disease will ever occur? कि action that halts the progression of a disease? What basically you are doing in primordial? Yes, so many students are saying B. Nitin, Gaurav, Hakeem, Osama, Tejaswini, study point, everyone is with B. Is it? What is B? It is the prevention of emergence of development of risk factors. Yes. So primordial है कि risk factor ही हटा दो. राइट, कोई स्मोक नहीं कर रहा तो उसको और रीइंफोर्स करो कि हाँ तुम नहीं कर रहे हैं, मुझे पता है लेकिन अच्छा है तुम नहीं कर रहे, बहुत अच्छी बात है, मैं भी नहीं करता तुम भी मत करो, ठीक है. सो उसको हम और रीइंफोर्स कर रहे हैं. द रिस्क फैक्टर्स आर एब्सेंट, वी आर एलिमिनेटिंग द रिस्क फैक्टर्स. दैट इज प्रिमोर्डियल. राइट. इफ आई एम चेंजिंग दिस क्वेश्चन, instead of primordial I am asking the question as primary, what is your answer now? From ABCD, the same option. What is your answer now? Dopamine, what is your answer? Rakesh, Pinky, what is your answer now? I am changing the question. What is your answer? So what is primary level? Yes, very good Tejaswini. Yes, Osama, Nitin, Gajanan, very good Hakim, very good. So it's action taken prior to the onset of disease. The risk factor is already present, but disease has not yet appeared. The person is smoking, but lung cancer has not occurred till now. So that is the answer will become A. That is primary level. Again, I am changing the question and changing the question to secondary. What is your answer now? What is your answer now from ABCD? Read the options. Yes, what is your answer now? Let me see who will answer. Yes, what is secondary? The disease already occurred, but you want to prevent from early to late. What basically you were? Yes, Nitin. No, Pinky, it's not C. It's action that halts the progression of the disease. So you prevent the disease from early to late. Right, so that is the secondary level of prevention. Yes, the answer will be D. Yes, Tejaswini Gajanan. You got it. So it depends from the same question. I can change a little bit in the question and the answer will change. Right. Action taken to remove the possibility that disease will ever occur. ऐसा तो कुछ है ही नहीं. There is nothing like that in the world. Give me a thumbs up. No, Rakesh, it's not C. It's D. It's D. Shrav, it's not C. It's D. Answer is D. You got it? I guess you have any confusion. The answer is D. Okay. The next question. I guess the most easiest question and everyone can answer it. Disability limitation is what type of prevention? Is it primordial, primary, secondary or tertiary? Disability limitation. Disability limitation is what? Yes, very good. So yes, you all are right. The correct answer here from ABCD, it's D. And every one of you is right. I'm not reading the names. Yes, good. Correct answer is D. These questions are repeated many times in your exams, right? Okay, next question. Now it is a difficult, tricky question. I'm warning you. Don't jump, huh? Think before you jump, right? Please think I'm warning you. I'm taking the pap smear for the detection of carcinoma of cervix. It is which level of prevention, right? We do pap smear now in females for the detection of carcinoma of cervix, right? So it is what? It is primordial or primary? It is primordial or primary or secondary or tertiary? For the carcinoma of cervix, we are doing so. What you will say? So most of them are saying C as answer. So it is secondary. Is it secondary? Yes. The person already have carcinoma of cervix. For the detection of that, early detection, we are doing the pap smear. The person already have carcinoma of cervix. The female already have carcinoma of cervix. But for early detection, I am doing the pap smear. The disease is already present. I want to diagnose it at early stage. So that is secondary. I guess you all, yes, in that also, Hakim, very good. In the secondary, it's diagnostic part, not the treatment. Yes. But the correct answer is C. Don't get confused in your exam. Right? So correct answer is C. Coming to the next question. Out of the 5 options. Now this is a PGI question. आजकल PGI नहीं होती लेकिन पहले होती थी PGI. Right? You can have multiple options correct. Right? You may be knowing that. ठीक है? मुझे बताओ primordial prevention in the coronary heart disease इनमें से क्या क्या है? What? Multiple options can be correct. So if one can be correct or multiple can be correct. Whatever you think. Primordial. I am asking only primordial for the coronary heart disease. Not primary. Not secondary. Only primordial. Only primordial. Exercising in high risk area. Is it primordial? BP monitoring. Is it primordial? Salt restriction. Come salt खाओ in the diet. Is it primordial? Take statins every day. Is it primordial? You know, statins are the drug which decrease your cholesterol. और TMT test करवाते रहो. You know, treadmill test. Is it primordial? इनमें से क्या क्या primordial में लोगे? तो ओसामा, राकेश are saying ABC. एक दूसरे का देख के मत बोलना आंसर. अपना brain use करो and tell your own answer. So Rakesh and Osama ABC, dopamine only BC. What about others? I want answer from everyone. Multiple options can be correct. Tell me, out of the five, which are primordial? Primordial is the action taken before the emergence of the risk factor. That is known as primordial. अभी risk factor नहीं है, उससे पहले ही आपने ले लिया. So those persons who are saying A as the answer, exercise in high risk area. मैं पहले ही high risk word use कर रही हूँ. High risk area मतलब risk factor present है. रिस्क फैक्टर प्रेजेंट है तो हाउ इट कैन बी प्रिमोडियल. ओसामा, राकेश, हाउ इट कैन बी प्रिमोडियल. अदर्स, सॉबोन, जो लोग भी ए आंसर बोल रहे हो, ए इज नॉट द आंसर. दैट इज माई पॉइंट. ए इज नॉट प्रिमोडियल. ए इज प्राइमरी. प्राइमरी मतलब रिस्क फैक्टर प्रेजेंट है बट डिजीज नहीं हुआ. यहाँ पे रिस्क फैक्टर प्रेजेंट है. क्वेश्चन में ही लिखा है हाई रिस्क एरिया. हाई रिस्क एरिया मतलब रिस्क फैक्टर इज प्रेजेंट. You got my point. तो रिस्क फैक्टर प्रेजेंट है तो इट कैन नॉट बी प्रिमोडियल. तो ए इज नॉट द आंसर. दैट इज फॉर श्योर. That is for sure. Give me a thumbs up. You got your mistake. Pinky, you got it. Say yes. So okay. Some are saying only C. Study point is saying only C. Some are saying BC. Some are saying E also. Let me tell you, answer is only C. Only C. So only one person is correct. Study point. Only C is the answer. Salt restriction. So basically, primordial is before the emergence of the risk factor. Before the emergence. If you are doing BP monitoring daily, तो तुम्हें पता कब चलेगा कि coronary heart disease है? When BP will elevate, when the person have hypertension. When the person have hypertension, it's already risk factor present. We do not want risk factor present होने से पहले बोलना है primordial. मैं primary पूछती तो आंसर A भी होता, B भी होता. मैं primary नहीं पूछ रही हूँ भाई, मैं primordial पूछ रही हूँ. Primordial मतलब even the risk factor are absent. Right? So BP monitoring से तुम्हें क्या पता चलेगा? The person is hypertensive, yes or no? Right? The person is hypertensive मतलब risk factor present है. You got my point? TMT तो तब abnormal आएगा जब already myocardial ischemia हो चुका है. Statins तो कब तब काम करेंगे जब already cholesterol बढ़ा हुआ है तो statins उसको कम करेंगे. I do not want risk factor to even happen. Please mind my words. I want primordial, the word. So answer is only C, salt restriction. Salt restriction, we all should eat a diet which is having low salt. We all should. Me, you, our parents, everyone in this world should take a diet which is low in NaCl because it is a risk factor for coronary heart disease. So we eliminate the risk factor. Even है ना, जैसे smoking कोई नहीं करता है तो उसको बोलो हाँ और मत कर. That is the point. You got my point. So correct answer is C. Everyone give me a thumbs up. Everyone. You got it. किसी में confusion है क्या किसी भी option में? So it was a good level question. It was a tricky question, right? Very few students can answer it correctly. Yes, the correct answer is only C. Only C. That's it. ठीक है? So again, multiple options are correct. E तक 5 option है. Multiple can be correct. Single or multiple, whatever you want, you can give your answer. Right? Among them, which of them are primary prevention? मैं primary पूछ रही हूँ, not primordial. Mind my words. It's primary. I'm asking primary. कितने primary बोलना चाहोगे? चलो बताओ फटाफट. How many of them are primary? Marriage counseling, is it primary or primordial? Early diagnosis and treatment, of course it is not primary, it is secondary. Pap smear, self breast examination in a female for the diagnosis of the breast cancer, and immunization. क्या क्या है? So few students are saying only E, few are saying B and E. Few are saying only E. What about others? Please everyone participate. Come on, एक दूसरे का देख के नहीं बोलना है, अपना अपना आंसर बोलो. Yes, so most of you are with D, E and E. Gaurav is saying A and E. Good, Gaurav. Okay, let's see. Let's see. Okay, so the correct answer among them is A and E. Gaurav, you are right. Others who have told A and E, if I am missing someone's name, it's right. It's right. A and E. Let me explain now. Let me explain you. What is primary? Primary is risk factor is present, but disease is absent. You want to halt at that point. This is known as primary. Yes or no? So marriage counseling with the couple comes to you, right? The couples come to you, the male and the female, that we want to marry together. Doctor, can we go for the marriage? Are we medically fit for each other for the marriage? So what you should check? You should check the blood group of the two persons. Blood group में ABO नहीं check करना है, positive और negative check करना है. That is RH factor. You may be knowing that, right? So the male can be, the female cannot be negative. Male positive and female negative. If this combination is there, it is deadly. Ask them, don't get married. Look for some other partner. And even if you are getting married, your first pregnancy will be all right, but further pregnancies can have complications. You can bond the couple. So basically, the risk factor is present in them, and the disease is still absent. Or for example, one of them is having any of the I must say the hereditary disease, like the male or female, both of them have thalassemia minor. The thal minor, not major, but if they marry together, the child can have thal major. So you can bond them. You don't marry together. One of your child out of the 4, 25% chances one of your child can have major because you both are minor. You got my point? So likewise, you can do multiple testing and advise them whether you are perfect for each other, medically perfect for each other, yes or no, right? So the risk factors are present, but the disease is still absent. You got my point? So that is marriage counseling is a primary. It is a primary. I guess you got it. Say yes if you got it. Say yes. Immunization, we already know it's primary. No need to explain. The risk factors, the polio virus is present in the environment, but I don't have polio because I'm vaccinated for it. You got my point? So risk factor is present, but disease is absent. So immunization is already there. Many of you have said the answer is self-breast examination. We ask all females after 45 years of age or after 50 years of age, once a month, every month, they should do both breast self-examination. There is a peculiar technique in which the breast lump have to be searched in all 4 quadrants. So these are the 2 breasts of a female, the 2 breasts of a female. So the breast is divided into the 4 quadrants like this, and there is a peculiar technique we teach the ladies, the 50 years, 45 years old ladies, to look for the lump in their breast, at least not daily, but once a month. So why we are asking the ladies to do so? Because breast cancer is very common in perimenopausal age. That is 45 to 55 years ki age mein it is very common, right? It is one of the second most common cancer in the world as well as in India. We want to prevent it. How we can prevent it? If even a smallest lump is happening here, even 1 centimeter or even a 0.5 centimeter. So if the lady is doing self-examination, palpating every here and there, so she can diagnose it at even a smallest size, and she can run to us, doctor, I can feel a lump in my breast. It is very small, so we can do early diagnosis. Basically, it is for early diagnosis and treatment. Early diagnosis we are doing. Otherwise, if she don't palpate, the lump will grow, and when it will become 3 or 4 centimeter, then she will be able to diagnose it. Not at early stage. So we want the lady to palpate the breast. Breast is full of fat now. There is abundant of fat. So even if a small hard lump is there, 0.5 centimeter, it can be missed. 1 centimeter, 2 centimeter, it can be missed. When it becomes 3-4 centimeter, then it will come in notice of the lady that I'm having some lump in my breast. You got my point? So basically, we ask them to do the breast self-examination for early diagnosis. So it is secondary level of prevention, not primary. We are doing early diagnosis. The lump is already there. Before the lump, can we diagnose? Can she diagnose? Before the lump happen, lump हुआ ही नहीं है, उससे पहले वो आके आपको बताएगी क्या कि मुझे होने वाला है फ्यूचर में? No, she cannot tell. Lump होगा, उसके बाद ही वो आपके पास आएगी कि डॉक्टर, I am having a lump in my breast. It's very small. You just see, is it a cancer? You got my point? Give me a thumbs up if you got it. Yes, Gaurav. It's a screening test, and it is secondary level of prevention, not primary. Right? Pap smear is also secondary, not primary. Early diagnosis and treatment. So these 3 are secondary. If I change the question and ask secondary now, your answer will become BCD. Got my point? In the primary, it's A and D. Everyone give me a thumbs up. Everyone. So this is how you have to deal with the questions. Use your mind. The questions are easy but tricky. They are easy but tricky. See the next question. So you are giving vitamin A prophylaxis to a child. Vitamin A prophylaxis to a child. What you are doing basically? Which I'm not asking the level of prevention. Is it primordial prevention? Ki secondary prevention? Ki primary? Primary hai, so is it health promotion or specific protection? ये दोनों primary के examples हैं. You got my point? Is it primary or primordial or secondary? First decide that. And whatever is it, tell me the exact answer. So Nitin is saying B, study point Rakesh, everyone is saying B. Some of them are saying C also. Hakim is saying C. Sobon is saying C. So is it B or C? Is it primordial or primary? First decide that. So it's primary, it's not primordial. Most of you are right. The correct answer is B. Primary may be specific protection. It's not primordial. Vitamin A prophylaxis. Why we are giving Hakim, others, those who are saying C as an answer. Why we are giving? Because in our community in India, vitamin A deficiency is very common. Vitamin A deficiency is a risk factor which is already present. If you are born in India, you have to face it. Right? So vitamin A deficiency is common in our diet. It is common in the child. So the risk factor is present. But you are preventing the disease. So you are giving specific protection. If you give vitamin A prophylaxis, the child will not have night blindness. The child will not have xerophthalmia. But on giving vitamin A prophylaxis, it is not that you are preventing the child from polio. No, we are preventing only from xerophthalmia, from the night blindness, from the bite out spot. जो भी चीजें vitamin A deficiency से होती हैं. So it is specific protection. You all are right. Give me a thumbs up. Yes, primary में specific protection है. You all are right. So the next question: which of the following is not a primary? Not a primary. One of them is not primary. Tell me that. Which of them is not a primary way of prevention? Can you tell me the answer? Breast self-examination, control of tobacco, radiation protection, and cancer education. Which of them is not primary? Yes, Tejaswini. Yes, Gaurav. Very good. Just now I taught you. Breast self-examination is secondary way of prevention. The lady palpating the breast can only come to you when she will have a lump. Having lump is secondary, not primary. The disease is already present. But control of tobacco, government is trying to control the tobacco now. On the packet of tobacco, it's written that it causes cancer. Still, person smokes. I don't know why. I guess they are mad, but still they smoke, right? It is written on the packet clearly. So for the control of tobacco, the government is increasing the pricing of that. There is no advertisement of the tobacco. It is a rule. You cannot advertise the tobacco on television, on any internet, on any mass thing. You cannot do that, right? Advertisement पान मसाला का होता है, टोबैको का नहीं होता है, राइट? टोबैको को कोई नहीं कर सकता. इट इज इलीगल टू एडवर्टाइज टोबैको. यू कैन नॉट डू दैट. In the movies or in some serials and web series, someone who is smoking, there is a disclaimer written in the bottom. You may have seen that smoking can cause lung cancer. It is injurious. So if you are showing it on the mass, you should show it with a disclaimer. So it is a rule. If you're showing it without disclaimer, the people can follow it blindly, right? Because for the people, the heroes, the actors, they are the role models of the society. So whatever they are doing, the people think it is right, right? So if some actor, the big shot is smoking on the screen, in a television, in a movie, in a serial, so people can follow it blindly, but it is not a good thing. So you should show a disclaimer, right? So that is control of tobacco. The risk factor is present, but the disease is absent. It is primary. Radiation protection, cancer education, these all are primary. Yes. Yes, so I also think so. Shroud, why not to ban that? So it is all politics. Why not to ban that? The taxation, the politics, the money, and all the dirty things are there. So we cannot win on that. But what we can do, being a doctor, we can educate the people, as many as we can live. Right? So even if you're protecting one life in the complete life, if you are giving a good life to even a one person, no, saving one person from the disease, it's worth. It's worth. So you can always use your wise words, your knowledge for adding some quality of life in the person. Anyways, so let me go ahead. The correct answer here is A, and you all are right. So let me go. This one. Can you tell me the answer? This one. Iodized salt in iodine deficiency control program is what? We provide iodized salts nowadays, now. I eat iodized salt. I eat Tata ka namak, right? And Ashirwad namak. Many salts are there in the market. I'm not promoting some particular brand. Please don't take me otherwise. So whatever salt we eat, now most of them are iodized. Non-iodized salts are also available, but it is advisable to purchase the salt from the market which is iodized. So what level of prevention it is? We all want to prevent goiter in all of us, right? The government is providing iodized salt. So is it primary, secondary, tertiary, or primordial? What do you say? Yes, you all are correct. It's primary. Primary, maybe it's specific protection. It's only against goiter, not against other diseases. Yes. The primary protection, yes, fortified food. Very good. I have given this example. It's fortification. So that is the next question. Can you tell me the next question? Can you tell me the target for secondary prevention? Secondary prevention का target कौन है? Secondary prevention में you are giving secondary prevention to healthy individuals, to patients, to animals, to children. What is your answer? Secondary prevention. Yes, Sawbone. Yes, very good. You are giving it to patients. Come on. Secondary prevention is given to those who already have disease. The one who have disease is a patient. So there are four prevention now. Primordial, primary, secondary, and tertiary. Out of them, these two are given to the healthy population, and these two are given to the patients. You can think. Primordial and primary, the person don't have disease yet. So I will call them healthy. And secondary and tertiary, the person already have disease. So they are the patient. So what is the target for primordial and primary? It's, if I change the question, if I ask you primary here now or primordial, your answer will become A. But if I change the question and ask secondary or tertiary, your answer is B. So answer is between A and B. Yes. You got it? Yes, Hakim. It's early diagnosis and treatment. It's for patients, not for healthy. Right? Okay. Childhood obesity prevention is a type of what, right? We all have children, or you will have your children in future. We should not let our child to become obese, right? We should provide a balanced diet to the child so that they don't have obesity. Obesity is a disease. It is not a sign of richness. It is a disease, right? We prevent the child from obesity from the childhood only. We should provide a balanced diet. We should provide less cholesterol, less oil. We should ask the child to be physically active always, right? So what type of prevention we are providing to that child so that the child will grow up one day, become young, and child will not have diseases related to obesity. So the risk factor, yes, what type of it is? Is it primordial or primary? What you will say? The confusion is between A and B. What you want to say? Primordial or primary? Take one side. Take one side. Yes. So someone is saying B, someone is saying A. Yes, it's primordial. The risk factor, even you want to eliminate the risk factor. From childhood only you are preventing the obesity. So obesity ही नहीं होगा, risk factor ही नहीं होगा, तो obesity की वजह से जितने भी diseases होते हैं, the coronary artery disease, the heart disease, the MI, जिसमें जिन भी diseases में obesity होता है वो disease भी नहीं होगी, क्योंकि obesity ही नहीं है, because you are eliminating the risk factor. You are not eliminating the disease, you are eliminating the risk factor for the disease. Please mind it. You got it. Rakesh, you got it. Gaurav, it's not B, it's A. You are not eliminating the disease. Come on. You are eliminating the obesity. Obesity is a risk factor for multiple disease. You are eliminating the risk factor by doing so. So it is primordial. It's not primary. Give me a thumbs up those who were saying B. जो लोग primary कह रहे थे, Osama, Gaurav, you got it. It's not primary. It's primordial. You got it? Yes or no? लिखो. You got it? Why it's primordial? If I say childhood में ही मैं MI prevent कर रही हूँ, तो वो प्राइमरी होगा. मैं CAD प्रिवेंट कर रही हूं तो वो प्राइमरी होगा, लेकिन डिजीज नहीं, मैं तो उसका रिस्क फैक्टर ही प्रिवेंट कर रही हूं. ना रहेगा बांस ना बजेगी बांसुरी. ओबेसिटी नहीं होगा तो ओबेसिटी से रिलेटेड कोई भी डिजीज नहीं होगा. सो दिस इज प्रिमोडियल वे ऑफ प्रिवेंशन. So always there is a confusion between primordial and primary. You get confused in the exam. The questions are very tricky, believe me. You got it? The correct answer here is A, not B. Can you tell me the last question? Monitoring of blood pressure. We all should monitor our blood pressure regularly, once a week, right? और वंस अ मंथ करते रहना चाहिए. आफ्टर 45 ईयर्स ऑफ एज तो करते ही रहना चाहिए, वंस अ मंथ और वंस अ वीक. व्हाई? विच टाइप ऑफ प्रिवेंशन इज इट? विच टाइप ऑफ प्रिवेंशन? व्हाट डू यू वांट टू से? इज इट प्रिमोडियल, प्राइमरी और सेकेंडरी और टर्शियरी? ऑफ कोर्स नॉट टर्शियरी. इज इट प्रिमोडियल, प्राइमरी, सेकेंडरी? मॉनिटरिंग ऑफ ब्लड प्रेशर क्यों करना चाहिए? आई ऑलवेज आस्क माय पेरेंट्स टू मॉनिटर देयर ब्लड प्रेशर रेगुलरली, वंस अ वीक और वंस अ मंथ. I'm having a sphygmomanometer at my home and I myself monitor their blood pressure regularly, very regularly. Why so? Why? What do you want to do? So many students are saying B. That is primary level. No, it's not primary. Use your brains ना. Come on. Blood pressure तुम monitor कर रहे हो, क्यों कर रहे हो? जरा सोचो, अच्छे से सोचो. Blood pressure हम इसलिए monitor कर रहे हैं कि वो hypertensive तो नहीं है. वो hypertensive तो नहीं है, उनका blood pressure raise तो नहीं है. Hypertensive is a disease already present है, तो how it can be primary? It has to be secondary. मॉनिटरिंग ऑफ ब्लड प्रेशर तुम रोज करोगे, आज नॉर्मल आया, कल नॉर्मल आया, परसों नॉर्मल आया, उसके बाद हाइपरटेंशन आ गया, तो तुम किस पॉइंट पे प्रिवेंशन दोगे? जब हाइपरटेंशन ऑलरेडी हो जाएगा. कैसे मैं समझाऊं? अगर मॉनिटर कर रहे हैं हम ब्लड प्रेशर और वो नॉर्मल ही आता जा रहा है, so you will not go to the doctor that my blood pressure is normal, I'm monitoring it daily and it's normal. So doctor will say, why you are coming to me? It's normal. Go to your home, check it regularly. Once if it is hypertension, then at that day you come to me. Why you are coming to me today? So you cannot prevent it at primary level, you cannot prevent it at primordial level. So you just regularly monitor it. The day it become hypertensive, at that day only you diagnose it. इसलिए रेगुलर मॉनिटर करो. तुम सालों तक मॉनिटर नहीं करोगे और 2-3 साल में एक बार मॉनिटर करोगे. आज हाइपरटेंशन आ गया, आप पिछले 1 साल से या कि 2 साल से, मुझे क्या पता, मैं रेगुलर मॉनिटर ही नहीं कर रही थी, लेकिन मैं हर वीक मॉनिटर करती हूँ या फिर मैं हर रोज मॉनिटर करती हूँ. तो जिस इंस्टेंट पे वो हाइपरटेंशन होगा उसी पॉइंट पे मैं उसको पकड़ के ट्रीट कर लूंगी. तो मैं समझ में आया क्या? हिंदी में बोला तो समझ में आया क्या? सो रेगुलर मॉनिटरिंग हम इसलिए कर रहे हैं ताकि जिस दिन हाइपरटेंसिव हो उसी दिन पकड़ के ट्रीटमेंट दे दें. So basically we are doing early diagnosis. The same question with the breast self examination. Breast self examination lady daily करेगी, daily नहीं करेगी, once a month, once a week करेगी, right? तो उसका अगर लंप नहीं मिलेगा तो वो डॉक्टर के पास नहीं है कि डॉक्टर मेरे ब्रेस्ट में कोई लंप नहीं है, मैं उसको रेगुलर मॉनिटर कर रही हूँ. डॉक्टर विल से मेरे पास क्यों आए हो? आपके पास कोई लंप नहीं है ना, मॉनिटर करते रहो, वीकली मंथली करते रहो, जिस दिन लंप मिले उस दिन आना. So we are basically doing early diagnosis. You got my point? Say yes if you got it. Say yes. Yes. These are secondary, right? So ये सब confusing question है. I know 80% of the audience is wrong in these questions. You got my point? So that is the thing. So I would like to stop. Questions तो बहुत हैं, unlimited हैं, क्योंकि इस टॉपिक से एक क्वेश्चन डेफिनेटली आता है तुम्हारे एग्जाम में. बिना लेवल ऑफ प्रिवेंशन के कोई पेपर नहीं होता. Still I am having 20 more questions with me, but the time is limited. Now we cannot do it all. 20-25 more questions with me. Okay, I have to stop now. So thank you very much for being with me. I really enjoyed teaching you. Hopefully same from your side also. Have you learned the level of prevention? Give me a thumbs up everyone if you learned it. Give me a thumbs up. Have you learned it? Yes? Still if you have any doubt in any question, I suggest you to use whatever platform you are using for your MCQ practice. You may be using some platform now, some online platform, digital platform, or some hard copy book. Whatever, the hard copy, the soft copy, the digital, online, whatever platform you are using, do all MCQs of this topic today only. That is my advice to you. To follow or not, it's your choice, right? So do all the MCQs. There are more than 150 or 200 MCQs on this topic, the level of prevention. You, in all the question, you have only 4 options: primordial, primary, secondary, tertiary. If you have the concept, decide it. Right? You do the question. If you have any doubt, don't hesitate to ask me on this number. This is my contact number. It's 9833032948. You can contact me either on WhatsApp or Telegram. But text me, don't call me. Text me. Whenever I will get the time, I will get back to you. Your doubt. So in 1 or 2 days, I will get the time. It is not very instant. It may be, but I will definitely get back to you. Thank you so much. Don't forget to share your college name, university, and exam dates. What exams you are targeting for. I can help you with schedule of your particular exam. If you are preparing for the university exam or some competitive exam. Thank you very much for being with me. Thank you so much. If you like the lecture, don't forget to click on the like button before leaving. Subscribe our YouTube channel and share the link with all your friends, colleagues, all the medicos throughout the globe. Whatever medico is there, and the medico is interested for the PSM or for pathology, pharmacology, microbiology, medicine, please share the my YouTube channel link. And please press the bell icon for getting notifications. Thank you. See you. Bye bye. Study hard. Wishing you all the best. I'm ending the session.